Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you another fascinating guest who is helping to create a better tomorrow on many different fronts. We have the honor of today being joined by Ambassador Dr. Román Macaya Hayes, who is a Costa Rican scientist, entrepreneur, diplomat, and public servant. He had most recently served as the chairman of the board of the Costa Rican Social Security Organization, CCSS, the institute that financed and provided universal coverage of public healthcare services in Costa Rica, as well as manages their largest pension fund of the country. In that role, he led the healthcare delivery response to COVID-19, as well as spearheaded key priority programs, including the deployment of the largest investment in both physical and technological infrastructure in their history, promoting vast programs of innovation throughout the institute, implementing digital transformation agenda, and ultimately revamping both the healthcare delivery and pension system to respond to the increasingly aging population, a very important topic. Prior to leading the CCSS, Dr. Macaya was also served this role as Costa Rica's ambassador to the United States. He held that post from 2014 through 2018, and in the role of his ambassadorship, Dr. Macaya promoted science diplomacy between countries in the areas of biomedical research, space, water, biodiversity, and technology. Ultimately was involved as well in strengthening cooperation and security, migratory matters, environmental conservation, and the arts. Worked closely with the White House, Department of State, and the Department of Homeland Security here to strengthen Costa Rica's capability in both drug interdiction, as well as various other initiatives. Dr. Macaya, in addition to these roles, has held various leadership positions in both the healthcare and agricultural industries. He has served as a biomedical scientist in the biotech industry, as a businessman, entrepreneur in clinical research, private equity, and healthcare consulting. And in the field of agri-tech, he served on the board of directors of Costa Rica's National Chamber of Agriculture and Agro-Industry, led a major crop protection company, presided over national, Latin American, and global industry organizations, engaged with governments and multilateral institutes such as the World Trade Organization, WHO, and the Food and Agriculture Organization in Rome. Dr. Macaya holds his MBA in healthcare management from the prestigious Wharton School here at the University of Pennsylvania in Philadelphia. His bachelor's degree was in chemistry from Middlebury College, and he did his PhD in biochemistry from UCLA. We are honored to have him with us today. Ambassador Dr. Román Macaya Hayes, thank you so much for taking the time out of your schedule to come talk to us for a while.
Thank you very much, Ira, for that very generous introduction, and it's a pleasure to be on your program for another interview. I appreciate the invitation.
It's really great to have you. You have an amazing and lengthy background. And I would love to start off, as we typically do, by handing you the floor for a little bit, just so we can learn a little bit more about you and your background. If you could take us to sort of into the early days, from everything from where you grew up, when you developed some of these interests, not just sort of early interest in science, but in getting into areas like I was looking at your papers, researching oligonucleotide thrombin inhibitors, what got you interested in crop protection, and you talk a little bit about your days here in Philadelphia at the Wharton School. That'd be kind of cool too.
Sure. Well, I grew up in a bicultural household. My mother is Bostonian. My father is Costa Rican. I grew up in Costa Rica, went to school through high school in Costa Rica. And I knew very on as a child that I liked the sciences. You know, I was a little bit of a nerd, and really loved science fiction and you know, anything to do with science. And when I graduated from high school, and you know, was looking at colleges, and you know, ended up at Middlebury College in Vermont, which was quite a change from tropical Costa Rica going to the cold, long winters of Vermont. But it was the right place for me, and I was able to develop that, or continue developing that passion for the sciences. I should say in the early days of my college career, freshman and sophomore year, I still didn't know which science. So I was taking actually the requirements for majors in physics, math, biology, and chemistry, because I still hadn't narrowed it down to one. And by the end of my sophomore year, I said, I'm going to kill myself if I don't choose one and narrow down the course requirements. But so I ended up studying chemistry, and my dad is a chemical engineer, so he certainly had a role in cultivating that interest for the you know, the physical sciences. And when I graduated from Middlebury, decided that I wanted to continue in the sciences and you know, dive deeper. At that time, the whole area of biotechnology was really exploding. And so that's the field I wanted to get into. It was very exciting, and ended up going to UCLA for a doctorate in biochemistry. And you know, things sort of evolved after that. I was hired out of grad school to run a structural chemistry lab at a startup in New Jersey that at the time was called Pharmagenics. It was later acquired by Genzyme in Boston. And but I was getting sort of at the point where I wanted to see the broader impact in healthcare. You know, how can we move the needle in healthcare, not just with therapeutic interventions, but policy as well. And that's when I decided that I would go to broaden my horizon, attended the Wharton School for an MBA in healthcare management, specifically in health systems management. And loved it. I loved my 2 years in Philadelphia. You know, it's a great city, not too big, not too small, and a great group of classmates at the Wharton School. So I have very fond memories of those years. And after that, I returned to Costa Rica. So I had been in the US for 14 years, and you know, I had studied healthcare. I'd been involved in research. So my first job was running clinical trials in Costa Rica. Okay. And then I got into healthcare investing, and then healthcare consulting and agribusiness. And later these, you know, two positions in public service, which are very different from each other. One is ambassador of Costa Rica to the United States. And we can talk about those. And the second one as head of the public institution that provides all public healthcare services, which is the Costa Rican Social Security organization. And it's essentially, it's a single payer, single provider institution that has a very important role in Costa Rica. And I had the honor of serving Costa Rica in both of these roles as ambassador with one of our most important strategic partners on the international scene, the United States, and where I was serving as an interface between two countries that I love. You know, I at the time, right before that, I was a dual citizen. I was half, you know, well, fully American and fully Costa Rican. But I had to renounce my US citizenship in order to serve as ambassador of Costa Rica to the United States. And that was a tough decision, but it was one that I figured I had to do if I wanted to serve in that role. And you know, in the second role, which was very important to begin with, but became even more important as the pandemic hit, because the institution that I led was responsible for the healthcare response in caring for all these patients that were affected by the pandemic,
Mhm.
and those that we normally have to care for anyway, even without a pandemic. So it's been a very varied and multidisciplinary career, but I throw that out there and dive into any part you want to talk about.
Yeah, absolutely, and I appreciate that intro. And I'd like to dive into all of that. And I think a really exciting, thinking of the path now, and your days in industry. You're in agri-tech, you're in healthcare systems. You enter your ambassadorship, and I came across this really interesting material from, I think it was a 2017 American Association of the Advancement of Science, and there was a plenary session that you were attending on science diplomacy, science, technology, and innovation for the Sustainable Development Goals. And it basically talked about, you were talking about how in the embassy at the time, it was 2017, there's strong emphasis, very important, science diplomacy. We need to discuss science and technology related things every day. That can be related to fishing. It can be related to Zika virus at the time, natural disasters, whatever may be on the table. We need to discuss at least once a day. And we need to engage the scientific community, both locally, globally. You set up scientific open houses while you're the ambassador. You signed memorandums of understanding with universities like University of Pennsylvania Medical School. Talk a little bit about what science diplomacy is all about and why it was so important in your ambassadorship.
Well, when I first arrived in Washington as ambassador, my first question is, here I am, an ambassador with a scientific background. What can I do to use that background to further diplomacy? And that was science diplomacy, basically combining diplomacy and science to promote scientific collaboration and technical collaboration in a number of areas. And it turned out to be a very productive sort of lane of work in our embassy. And we ended up positioning the embassy in a very strategic role within the community of embassies in Washington, as an embassy that had really prioritized science diplomacy. And as you mentioned, some of the cases, we signed agreements with or memorandums with the University of Pennsylvania, and we set up collaborations with different universities, different institutions across the scientific enterprise of the United States to collaborate with the scientific community in Costa Rica in a number of areas. In space, one of my first roles in science diplomacy, I was at the embassy, and I received this email by a very famous Costa Rican astronaut, Chang. And he's a dual national. He's Costa Rican and American. And he's a co-holder of the world record on the number of times into space. So he's gone into space on 7 shuttle missions. Nice. And, he had studied at MIT, where his thesis was developing this plasma-based rocket. And he developed this technology over about 25 years of his career at NASA as an astronaut, but also as a scientist. And then he negotiated with NASA an agreement to turn that into a company. And today it's a private company called Ad Astra. He sent me an email and said, look, I need to give an update to the Office of Management and Budget, or the MBO sure. office at the White House, on a state of the technology of this plasma rocket. And he hasn't had an answer from the White House. And, is there any way that I might be able to help? So I sent an email to the White House and got an answer right away, the same day. A couple hours later, we'll receive him on such and such a date. So I answered him back, they will receive you at the White House on such and such a date. And he said, wow, that was quick. And so So he came up and we all went to the White House to give this state of the art or state of the technology update on this rocket. And I thought, wow, this is really cool. This is an area where we can collaborate in scientific fields, because this company, which is based in Houston, has a subsidiary in Costa Rica, okay. and do something that's useful and productive for both countries. So that was sort of my kickoff of in science diplomacy at the embassy, and we did many things in the biomedical science area. One was with George Mason. Mm-hmm. The Zika virus was the big viral threat that was coming up the Americas at that time. And George Mason had this large biocontainment lab, this facility that was equipped to be able to work with live viruses, live pathogens that were very dangerous. And so we arranged a visit of a team from George Mason, and along came the director of this big lab. His name is Charles Bailey, and set up a collaboration, and we're ready to sort of start working on this. But then the virus kind of petered out. Mm-hmm. But you know, relationships that are established can work and help later on. And when in my new role as president of the healthcare system of Costa Rica, once the pandemic hit, we had the opportunity of thinking about new therapies for this virus. And there's an institution at the University of Costa Rica that works on developing anti-venom products mm-hmm. for snake bites, and they're made from horse antibodies. So we had the idea, well, what if we develop horse antibodies against SARS-CoV-2 virus? And, you know, this was started, and in record time, these antibodies were prepared, purified, and ready to go, ready for testing. But we needed to test them against a live virus in the lab first to see what was the potency in neutralizing this virus. So all it took was a phone call back to George Mason. And within, you know, a couple weeks, we had the answer of what was the potency of these antibodies in neutralizing this new viral threat. And today, those antibodies are in clinical trials mm-hmm. against COVID. So it goes to show you that some relationships that are established, perhaps in one area or one field, can then carry on to other areas that are unexpected at the time. But the important thing was getting the relationship in place in order to be able to kickstart a new project that can have an even more important impact than what we were envisioning when we were talking about the Zika virus.
The part of, the part about the CCSS and the involvement, part of the equine antibodies, is just a fascinating innovation story on its own right. When we think of Social Security, of course, in the United States, it has sort of one meaning, but the CCSS, as you were explaining in the intro, you do quite a bit more in terms of, you not just have the various clinics and hospitals, but involved in all sorts of preventative and therapeutic programs, vaccination, fumigation, surgery, pharmacy, clinical development. Talk a little bit about this further. And then, of course, a key component of this, as you were just mentioning with the equine antibody work, innovation. And this is once again, I think Social Security, we don't think too much about innovation for the United States per se, but talk about how other examples, if you could, like the equine antibodies, of how you weave innovation into the CCSS mission.
Yes, that's a great question. First, to put it in context, yes, Social Security in the U.S. context is usually thought of as pensions. Okay, right. This is my retirement pension through the government-run Social Security program. In Costa Rica, Social Security entails not just pensions, which it does entail, but it's not limited to that, but also healthcare. So in Costa Rica, everyone has a constitutional right to life. That's in the Constitution. Our Supreme Court in Costa Rica has interpreted that as if you have a constitutional right to life, you therefore must have a constitutional right to health. And if you have a constitutional right to health, someone has to provide health care to materialize that constitutional right to health. And so the entity that guarantees that constitutional right to health care is the Caja, our Social Security institution that owns, finances, and operates all public hospitals, clinics, physician networks, all the workforce in the public healthcare system, which is about 63,000 people, and all procurement of drugs and medical devices and anything that's required in the healthcare system. So it's a very important institution because it fulfills a constitutional mandate. It has a budget of about $8.5 billion a year, which is about 13% of our GDP. That's for both pensions and healthcare. And as I mentioned, has 63,000 plus workers working in the institution. So it's a very large institution with a big budget and a huge mandate. Now, if you look at the mission of the Caja, which we call it in short, is the Caja.
Sure.
One of the elements of the mission is to promote research in the health sciences. Now, even though that's in the mission, that had not necessarily been done in the past. And so one of the things that we tried to promote over the last 4 years of my mandate in the Caja was precisely that. How do we promote biomedical research within the institution to fulfill the mission that's stated in its charter? And so we put in place and approved a regulation for the implementation of clinical research within the institution. The board of directors approved a policy to promote innovation and research within the institution. We also got the board to approve a policy for the use of biomedical data, because all of our hospitals and clinics are connected through an electronic record system. So there's a lot of health data that's available in the system, and we need to strike the right balance between protecting the individual rights to privacy of biomedical data, but also find ways of using that data responsibly for furthering science and the application of healthcare to our citizens. So we did that, and when the pandemic hit us, this accelerated everything. Mm-hmm. So, there are very few good things about a pandemic, but one good thing out of this pandemic was changing the culture around biomedical research in a public institution that was not known to be heavily involved in biomedical research. Very early on, we needed to know what worked, whether it was convalescent plasma, whether hydroxychloroquine, or new therapies like the one, that we're co-developing on these horse antibodies against COVID. We need to know if these, had evidence that they would be effective. And so clinical trials were implemented in record time within the system. This is something that probably would not have been possible to implement so quickly without the pressure of a pandemic on top of us. Mm-hmm. And so it helped to change the culture within the institution. And now there are trials that are ongoing and studies that are ongoing that are not COVID related. The institution has declared certain types of biomedical studies as studies of institutional interest. Okay. And this helps us to accelerate their implementation and to provide resources so that they are implemented. So I would say that that's one of the very few good things that have come out of this pandemic, is a change of culture to appreciate the value of science and biomedical research within the public healthcare system of Costa Rica.
One of the areas that I know was very important to you in your leadership of CCSS was the area of population aging. And, I had the honor of, for a couple of years, of being on this World Economic Forum Human Enhancement Council with Ambassador Lorca. Came after you in the embassy, but this theme of a health span was so extremely important in these discussions about if we spend so much money during those last years of life and sort of the morbidity that creeps in, and if we can shrink that just a little bit. The numbers are unfathomable about what they could yield to the global healthcare system. Costa Rica, I look at the UN list, it's up there in terms of life expectancy, well above the United States. We know you for the blue zones and all that. Talk about this theme, if you would, a little bit more of your own interest in population aging, but also as Costa Rica's development of this, I'll call it sort of technological hotspot for things that are happening in the health span improvement world.
Yes, no, it's a fascinating topic. As you mentioned, Costa Rica has a blue zone. There's only 5 identified blue zones in the world: 1 in Greece, 1 in Japan, 1 in Italy, 1 in California, and 1 in Costa Rica. These are zones where a large or a disproportionate percentage of the population lives exceptionally long lives, often surpassing the century mark. Yeah. And many of them live relatively healthily well into their late years. Yeah. And that's very unusual. So why is this happening? Well, in Costa Rica, you mentioned that our life expectancy is up there with the developed world. Costa Rica is a middle income country, but we have first world, developed OECD standard Yep. life expectancy indices. So that's unusual to begin with, but what's even more unusual is that as people age anywhere in the world, you end up pushing out your life expectancy, your future life expectancy. So if for example, today in Costa Rica, for a newborn today, their average life expectancy at birth is over 80. Now, that doesn't mean that when you're 79, your average future life expectancy is a little over 1 year. No, because you keep pushing it out because you end up in new averages as you age. That happens anywhere in the planet. What's unusual about Costa Rica is that effect is very pronounced, to the point where the cohort of 90-year-olds in Costa Rica has among the longest life expectancies in the world. So we don't have the longest life expectancy at birth, but as we age, we push out that life expectancy faster than any other country on the planet. Mm-hmm. So a 90-year-old in Costa Rica outlives on average a 90-year-old in Japan. And what makes it even more interesting is that the group that contributes most to this average life expectancy is the men. Mm-hmm. Women tend to outlive men anywhere in the world. And that's also true in Costa Rica. But we get closer as we age, to the point where that 90-year-old woman in Costa Rica, on average, will live about the same as a 90-year-old woman in Japan. But a 90-year-old male in Costa Rica will outlive the Japanese 90-year-old male. And I use Japan as the example because of the exceptional life expectancy that you find in Japan. And no one knows why this is the case. What is special about Costa Rica that pushes out our life expectancy faster as we age than in other countries of the world? So early on in my last job as executive president of the CAHA, I was asked by the National Academy of Medicine, that's led by Dr. Victor Zhao, to be on the oversight committee of a group that was being put together to study healthy longevity, or that lifespan. How can we promote policies that will keep us healthier later in life? Because if we can compress the aging effect morbidity into fewer and fewer years in our late lives, that will help a lot to, first of all, live better lives, but also in the sustainability of our system. Our Social Security system, as I mentioned, that deals with pensions and healthcare, is impacted very strongly by aging, because as people age, of course, there's going to be more people that require a pension. But on the healthcare side, they're going to be utilizing our healthcare system much more intensively than they do when they're younger. And I'll give you an example. Looking at our data within our healthcare system, the cohort of people that are 65 or older uses, on a per capita basis, 13.5 times more hospital days than the cohort between 20 and 40 years of age. So our population doesn't have to grow much in order to impact our healthcare system. All it has to do is age. So the people that are walking around on the street today that have already been born, they're guaranteed to age, and they are guaranteed to provide that huge demand of healthcare services in the coming decades, to the point where our healthcare system and our institution is now a little over 80 years of age. So it was created in 1941, and it was very relevant for the development of Costa Rica over those 80 years. Mm-hmm. But the next 80 years are going to be even more relevant for our institution in caring for our Costa Rican population than what the first 80 years provided, because of that increase in demand for both pensions and healthcare. So sustainability is a big issue, and also, of course, quality of life of our elderly. So all of these things come into play, and that's why aging is such an important issue in our system.
Yeah, you mentioned sustainability, and it gets me now thinking to this broader picture now, because biomedical sciences, that's going to play an important part in what you were just discussing. But as you say, there's a lot more around the person. Costa Rica, you have the green economy. You have a tremendous amount of terrestrial biodiversity, not just your agribusiness, but in nature. You have the blue economy, two major oceans on both sides. Had the honor, once again, of having Minister Vega Castillo on the show last year, Costa Rica's Minister of Science, Technology, and Telecommunications, introducing us to this concept of the national bioeconomy. Talk a little bit, if you would, about your own visions coming from the perspective, she was expert in micro-robotics. Here I have a bioscientist in front of me. Talk a little bit about your thoughts on the national Costa Rican bioeconomy plans, if you would.
Yes, well, Costa Rica's economy has become much more diverse in the portfolio of products and services that are exported out of Costa Rica. So if you go back 40 years, Costa Rica exported primarily 4 agricultural commodities, essentially bananas, coffee, cocoa, and maybe beef, and that was it. Today, Costa Rica exports thousands of different products and very high value services, to the point where, in terms of physical products, Costa Rica's #1 export today is medical devices, anything from heart valves to all kinds of devices that are implanted or used in human health. And as far as services, our number one export is shared corporate services. There's a lot of companies that set up shared service operations that essentially provide service to the global operation of these companies. Now, because of the strengths in education and healthcare of Costa Rica, and this manifests itself in several ways. One is, the fact that we're a big exporter of medical devices. Second, medical tourism has become a big part of our offering in the healthcare. A lot of tourists come to Costa Rica for a medical procedure.
Yep.
And so the next step is, how do we cultivate a bioeconomy? How do we cultivate R&D so that we're not just producing the latest technologies, but we're developing and innovating these new technologies? And so, a question could be, can a city like Boston or, Silicon Valley be replicated if it has the right policies? Well, Costa Rica has an offering of universities that are of very high quality, very high academic value to bring into this ecosystem. We have experienced business leaders and a successful experience in entering certain sectors like medical devices and become a very important hub for the medical device industry. And some of them are starting to develop their products and services within Costa Rica. So how can we promote this? And that's where a new initiative that's ongoing right now, which is the life-centered hub in Costa Rica, where we want to promote life sciences in Costa Rica. That means biotech, medical devices, mining of biomedical data, clinical trials, and all of this. And biodiversity comes into play here. You mentioned Costa Rica is a very biodiverse country. What people don't necessarily realize is that it's the most biodiverse country in the world on a square mile basis. In other words, in Costa Rica, you find more species of living organisms per square mile than anywhere else in the world. And Costa Rica today has been a leader in what they call DNA barcoding. And this is largely the result of a couple, Dr. Dan Jansen and his wife, Winnie Hallwachs, Dr. Winnie Hallwachs. Both are professors at the University of Pennsylvania. And they have been studying Costa Rica's biodiversity for many decades. Well, there are so many species in our wilderness that there's no way we'll be able to identify all of these species through the normal taxonomic process, which usually entails a taxonomist, which is a rare species in itself, looking into a microscope and seeing if a fly or a butterfly or a certain plant or certain fungi are a unique species or not. Well, along came this way of looking at a specific gene that is shared across many, many thousands or millions of species. It's highly conserved, but it's not entirely conserved. So it's always a little different depending on the species. And Dr. Jansen and Dr. Hallwachs were one of the early adopters of this technology that was developed in Canada by Peter Herbert from the University of Guelph in Canada, on using this technology to literally DNA barcode species so that we can determine whether we're looking at a new species or not when these species or specimens are collected. Well, Costa Rica today, because of this effort, is the #1 DNA barcoded country in the world. It has more species that have been identified through DNA barcoding than any other country. And it was because of this early adoption by these two scientists from the University of Pennsylvania, but that spend half of their life in Costa Rica. They spend about 6 months out of the year in Costa Rica and 6 months in the US teaching at Penn. So a lot of interesting things are happening once you start to dig below the cover and see, okay, so what do we do with this biodiversity? Well, this biodiversity, it can be, the source of new industrial enzymes and new therapies, new drugs for diseases that don't have a cure yet. So all of this comes into play in this effort to promote a life science centered hub in Costa Rica. And we've gotten the Caja, our social security institution, involved because the Caja is sort of would be the whale in the fish tank. If we have access to so many patients, which is essentially the whole country, and we can also conduct biomedical research, that's certainly going to go a long way to creating critical mass for this effort.
Absolutely. And I think it's just such an elegant, I'm a huge fan of phytochemistry and natural products, and the long history of it in building up the pharmaceutical industry that we have today. And I think we've taken our eye off the ball with that one, to see it coming back, not just from the perspective of bioprospecting, but doing it with these 21st century tools, avoiding biopiracy and all that other stuff that came along with the past versions of it. It's so elegant, and I'm so excited about hearing about that specific program.
Well, as if you look at the history of the pharmaceutical industry, most drugs come from natural products.
Yeah.
They're either directly the natural product or they're synthetic analogs of the natural product. Yeah. And yes, Costa Rica is a signatory of the Rio Convention, so we aim to avoid biopiracy and to have benefits of products that are developed sustainably from our biodiversity come back to the country, so that there is a sort of a full circle of benefits. And so there is a potential of doing a lot with this, but we've got to get the right players in place with the right philosophy. And I think it's, we've done it in the past with INBio. INBio is the National Biodiversity Institute that signed deals with, the first one was with Merck, the pharmaceutical company. And then after that signed many agreements with pharmaceutical companies that entered into these benefit sharing agreements, where if a drug was developed, that part of the royalties of that would go back to Costa Rica and to be used to conserve that biodiversity that was the source of the drug to begin with. And so that, was full circle, conservation connected with healthcare, and then returning to conservation through royalties.
Very exciting. So, Román, it seems that you had some fascinating visitors to Costa Rica and the Caja in recent weeks in the area of some very cutting-edge cancer work that you're starting the organization. Tell us a little bit about what's going on the cancer front and who visited you last couple of weeks.
Yeah, well, it's an interesting story, and it's something that dates back to 2014. I had just arrived in Washington. And we had some bad news on my wife's side of the family. Her mother, my mother-in-law, was diagnosed with cancer, and they didn't give her, a good prognosis. So the whole family was in turmoil. We were very sensitive to what was happening in the field of cancer, what new therapies are available. Fortunately, and here we are, 2022. My mother-in-law is very healthy, and she beat cancer. So put that aside. But we were very in tune for what was happening. And at the time, this 2014, there was a interview that I saw on TV. My wife shouted to me to come watch this interview. And it was an interview with Dr. Carl June, where he was describing this new type of therapy called CAR T cell therapy that had essentially rescued this young woman, a young girl. She was 7 at the time. Her name is Emily Whitehead. And she was fighting leukemia and was at the point where there wasn't much left that the current state of medicine had to offer. And he had developed this new construct of this CAR T cell therapy that would be produced at a lab in Pennsylvania, at the University of Pennsylvania, and would be treated, this young girl would be treated at the Children's Hospital of Philadelphia, and the treating physician was Dr. Stefan Grupp. And it was a tremendous success. You know, this girl is now 17 and cancer-free 10 years later. So at the time I thought, this is something that we need to bring to Costa Rica somehow. And so we started visiting the University of Pennsylvania and talking with Carl June himself and his lab and his group. Also Dr. Bruce Levine, who produces these cells at Penn. Dr. Glenn Galton, who was leading Penn's outreach globally around the planet. And long story short, as my term as ambassador was coming to an end, we didn't have all the pieces in place for an agreement between Penn, CHOP, the Children's Hospital of Philadelphia, and the healthcare system of Costa Rica. But to my surprise, I was asked to run the healthcare system of Costa Rica in the public side by the next president. And so we picked up where we had left off on the diplomatic front, and now with a more focused healthcare perspective, continued these discussions. And it was this event that you mentioned that took place a couple weeks ago. We had a very important visitor to Costa Rica, the First Lady Jill Biden, Dr. Jill Biden. She is leading the Cancer Moonshot, really that has been relaunched by her husband, President Joe Biden. And she was in country, and one of the events that she attended was a kickoff event to launch this research collaboration between the Costa Rican Social Security system, which includes our public healthcare system, the University of Pennsylvania, and the Children's Hospital of Philadelphia. So we'll be doing research in CAR T cell therapies, and this will provide access to patients that have cancer that could benefit from these types of therapies. So it was a very positive visit by the First Lady, and the ambassador of the United States to Costa Rica, Dr. Cynthia Telles, was also involved in promoting this. And so it was a real good story where Costa Rica, a middle-income country, will be one of those few countries where patients will have access to developments that are coming out of the lab, from lab to bedside, to treat cancers with CAR T cell therapy.
Really very exciting, and an additional layer of exciting in the sense that again, Philadelphia connecting with Costa Rica, and then this really cutting edge set of programs. Really exciting work. What Roman, I introduced you at the beginning. I listed scientist, entrepreneur, diplomat, public servant. What's next? Any scoops you can give us while we have you? What's hot on for the rest of 2022? Looking at 2023, anything else that you can mention that I haven't talked about? But please, glad to give you the floor.
Well, right now I would call what I'm doing a sort of a sabbatical. Okay. My last job was very intense. Being responsible for caring for the population in the middle of a pandemic is a very high intensity responsibility. And, I'm glad that the intensity of the pandemic, even though it's not over, is much lower than it used to be. But my thought is to remain in some way connected to healthcare, but in innovation with healthcare and the life sciences in general. So I want to keep a footprint in the life sciences, in healthcare, and in innovation what that ends up being, whether it's, biomedical research or, trying to improve diagnostics or outcomes for patients through, the better use of healthcare information and so forth. I'm not sure. It's a work in progress. It's something that I will be fine-tuning over the coming months. I don't discard possibly teaching. So we'll see. But at the moment, I'm enjoying having a few tons of bricks taken off my shoulders in terms of responsibility, and getting a chance to really think hard about what I want to do next. But I appreciate the question. The short answer is it's a work in progress.
Well, we'll be, looking forward to seeing what's next. It's been, as I said, an amazing journey, and I just, I'm going to wish you the best with everything, whatever you decide to do. As we enter the new year coming up, it's going to be exciting, and you have such a potent engine, let's say, there in Costa Rica for making so many things happen. So really exciting. For everybody that is going to be listening to this particular episode of our show across the various podcast networks or watching on the YouTube channel, again, you've been listening to scientist, entrepreneur, diplomat, public servant extraordinaire, Ambassador Dr. Román Macaya Hayes, doing really amazing things with technology, with innovation, with sustainability. Román, I want to thank you for taking the time out of your schedule to come talk to us for a little while today. Obviously, thank you for everything that you've been doing the last few decades. And as we like to say on this show, thanks for helping to create a better tomorrow for so many people via what you do. It's a really wonderful story. And best of luck with what you get to do and what you get into.
Well, thank you very much, Ira. It's been a real pleasure to have this conversation and to be able to talk about a lot of different topics that where I can sense that you have a strong interest in as well, and so we have shared passion for certain areas.
Absolutely.
And I congratulate you for bringing guests to your program and to talk about areas that hopefully will be of interest to a lot of your audience.
They no doubt will. All righty, be well, Román. Good seeing you.
Thank you very much, and hello to anyone who's watching this program.